Before taking Vraylar, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to use this medication regularly to get the most benefit. Take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition does not improve or gets worse, be sure to inform your doctor. Some common side effects of Vraylar may include dizziness, lightheadedness, drowsiness, nausea, tiredness, excess saliva/drooling, blurred vision, weight gain, or constipation. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Dizziness and lightheadedness can increase the risk of falling, so be sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using Vraylar do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as fainting, trouble swallowing, restlessness, especially in the legs, shaking, tremor, muscle spasm, mask-like expression of the face, seizures, or signs of infection, like a persistent sore throat, fever, chills, or cough. Vraylar may rarely cause an increase in blood sugar, so it's important to be aware of symptoms of high blood sugar such as increased thirst or urination. If you already have diabetes, monitor your blood sugar regularly and share the results with your doctor. In some cases, Vraylar may rarely cause a condition called tardive dyskinesia, which can lead to unusual uncontrolled movements. It's important to notify your doctor immediately if you develop any of these symptoms. Additionally, Vraylar may rarely cause a very serious condition called neuroleptic malignant syndrome, NMS. Seek medical help right away if you experience symptoms such as fever, muscle stiffness/pain/tenderness/weakness, severe confusion, or fast/irregular heartbeat. While a serious allergic reaction to Vraylar is rare, it's crucial to seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. And always consult your doctor for medical advice about side effects. Before taking Vraylar, it's important to let your doctor know if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to inform your doctor about your medical history, especially if you have conditions such as diabetes, heart problems, high blood pressure, or nervous system problems. Vraylar may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness or clear vision until you can do them safely and to limit alcoholic beverages. This medication may also make you sweat less, increasing your risk of heat stroke, so it's important to stay cool and hydrated in hot weather. Older adults may be more sensitive to the side effects of Vraylar, especially seizures, drowsiness, dizziness, and confusion. It's important to be cautious to prevent falls. If you are pregnant, discuss with your doctor the potential risks and benefits of using this medication during pregnancy, and consult your doctor before breastfeeding while taking Vraylar. And as always, don't stop taking this medication without your doctor's guidance. When taking Vraylar, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Vraylar is metoclopramide. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much Vraylar and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Vraylar with anyone else. Before starting this medication and while taking it, you may need to undergo certain lab and medical tests, such as blood sugar, weight, and cholesterol/triglyceride levels. It's crucial to attend all your medical and lab appointments. Make sure to consult your doctor for more information. If you forget to take a dose of Vraylar, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Be sure to store Vraylar at room temperature, away from light and moisture. It should not be stored in the bathroom. Keep this medication out of reach of children and pets. Do not flush Vraylar down the toilet or pour it into a drain unless specifically instructed to do so. When this product expires or is no longer needed, be sure to dispose of it properly. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.